First, I'd really like to thank the entire GFAN family for First, I'd really like to thank the First, I'd really like to thank the entire GFAN family for your incredible leadership in championing and advocating for our seventh replenishment, which raised, as you know, a record $15.7 billion. We could not have done this without your remarkable support. I also want to recognize GFAN Africa's great work in engaging with African parliamentarians, emphasizing the impact of the Global Fund's investments across the continent. Indeed, in the lead up to the seventh replenishment, GFAN Africa engaged with numerous, over 30 members of parliament in African and donor capitals, making them key replenishment allies. GFAN support is of critical importance to the fight against HIV, TB and malaria, and to building a healthier and more equitable world. Increased domestic financing for health was a key part of our investment case for the seventh replenishment and is crucial to driving further progress against the three diseases and to achieving the objectives of the Global Fund's new strategy for 2023 to 2028. To strengthen the sustainability of national programs and enhance their impact, the Global Fund has, as many of you know, co-financing requirements designed to help catalyze progressive increases in spending on health and gradual uptake of program costs, including those financed by the Global Fund. Political support from African policymakers and MPs has been critical in delivering on these co-financing requirements, and your advocacy on co-financing will therefore be decisive in accelerating the end of HIV, TB and malaria and effectively strengthening systems for health. Yet many countries across the world, including in Africa, face acute fiscal challenges. COVID-19 has deeply impacted the world economy, and countries faced with a slow economic recovery, further exacerbated in some cases by conflict, climate change, growing debt, lower middle income countries are extremely overstretched and with often diminished resources to dedicate to their health systems. However, we must keep reinforcing the argument that prioritizing investments for health remains absolutely essential. We cannot lose momentum. With diseases as formidable as these, we can't let up. Investing in the fight against existing pandemics like HIV, TB and malaria is crucial and relies on proper financing for the underlying systems for health. And inadequate health spending weakens global health security and endangers progress on the Sustainable Development Goals. In terms of pandemic preparedness, the best way to prepare for future pandemics is to fight the pandemics that are killing people today and use those efforts to strengthen broader systems for health. Better and more equitable pandemic preparedness requires the same laboratories, supply chains, data systems, diagnostic tools, health workers, community systems built to fight diseases such as HIV, TB and malaria. It's not something different. Investing in these systems is a proven way to build the infrastructure and capabilities that underpin the prevention, detection and response to outbreaks. And domestic financing is fundamentally important in this context. This is why the task force First, I'd really like to thank the entire GFAN family for your incredible leadership in championing and advocating for our seventh replenishment,